go from there. Okay, so we have started the recording. Give me 1 second. Okay, very good. Sorry about that. Good morning, good afternoon, good evening, based on your time zone. Thank you very much for joining this webinar today. We are very fortunate to have Dr. Smitha Rao here with us. She's going to talk about a very interesting topic, especially interesting to me because my daughter is in this field. The topic is, what does a typical day look like in the life of a biomedical researcher? She is going to talk about what is biomedical engineering, how different fields are integrated within biomedical engineering, and what opportunities are available for an undergrad student to do research. So a lot of interesting things we'll be learning from her. This talk will especially be beneficial for the high school and college students who are trying to decide on the right major. And I know how big of a deal it is. Every day I get to have discussion with my daughter. Things change almost on a weekly basis. So hopefully you'll have some good information and good insight and guidance from Dr. Rao on that. This talk is a result of a collaboration between STEMatters and the Young Professional Society, our sister organization based off of UK. STEMatters' mission is to enable students to innovate, invent, and deliver quality solutions to contemporary challenges. And our mission is to inspire students to excel in the areas of science, technology, engineering, and environment matters by nurturing their critical and analytical thinking skills. And our sister organization, Young Professional Society, their mission is to help support and change the lives of youth by providing personal and professional development opportunities. It aims to bring to the forefront a more progressive, accomplished, and enlightened younger generation of people who will be the representatives and leaders of their communities and who will contribute positively towards the wider society. So let me introduce you with our speaker. Dr. Smitha Rao is currently an assistant professor in the Department of Biomedical Engineering at Michigan Technological University. She received her MS and PhD degrees from the University of Texas in electrical engineering, and her research focuses on interdisciplinary areas including MEMS, microfluidics, tissue engineering, nanofibers, and nanoparticles with application in cancer studies, scaffolds, sensors, and implantable devices. So thank you very much, Dr. Rao, for joining us today. We are very appreciative of that. Over to you.
Thank you so much. I'm so happy to be here. I really appreciate this invite. And I think what STEMatters is doing here is amazing. I wish I had attended a talk like this when I was deciding, and you'll know why I'm saying this in a little while. So let me go ahead and share my screen here. I'm just going to start with the presentation. So I wanted to talk about something that I think I see in a lot of the freshman undergraduate students. I teach a freshman class, and even in their first year of biomedical engineering, a lot of the students have this question: what am I going to do as an undergraduate student? And what will I do after I graduate? And I think these are very important questions to ask, especially if you're already in the field. But if you're deciding how to get into this field, I think I probably will have some hints based on my experience and what I have heard from my own students. This little image that you see on the left is cancer cells. And of course, we have the red cells as cancer and the green cells are the non-cancer cells. And this is actually a work that my undergraduate student did. So these are some of the things that I will talk about today. And without taking further time on this introduction, I want to go ahead. And as mentioned, I am in Michigan Technological University. For those of you who don't know, we are in the Upper Peninsula of Michigan, really as far north as you can get and as close to Canada as you can get. We get a lot of snow, but we also have 4 seasons. And this building here is actually where my lab is. And this little window is actually my lab. So we have a beautiful view. And right here are the trails. So you'll find my students out on the trails, taking a walk when they take a break. And, you know, as I mentioned, we have 4 seasons, but you don't really join a department or a field because of the campus or the 4 seasons. You have some idea of what you want to be when you grow up. So I have a quick poll for the attendees, and the questions I have are here. I'll open up the poll. Let's see if I can open this. So you should be able to see a poll. Do you know what you want to be when you grow up? Yes, no, I think I do. And I think my parents know. I put that in because I think a lot of the times the decisions kids make is based on what they hear from not just their parents, maybe their sisters, brothers, family members. This is great. I'm so happy to be in this majority where people don't know or kind of know, or maybe parents know. I'm very happy that there's very few or nobody who said yes, because that's really how undergraduate study works. You learn as you grow. So I'm going to end this polling here. I think I do is at 50%, no at 30%, and I think my parents know is at 20%. So what really I'm trying to bring out here is that we don't always know what we want to be when we grow up. I certainly did not know, at least I thought I did. My plan was to go to medical school, get a degree and become a surgeon, right? I was going to be a flying surgeon and change the world, until I got into dental school, and on my very first day saw a cadaver and realized that this is not for me. I cannot stand the sight of blood. And I thought this was the end of the world. What do you do, right? I mean, if you can't handle blood, how are you gonna make a difference in the medical field? And I was a little upset, but I was also, I had enough help around me. I spoke with a lot of people, and I decided I'm going to do the next best thing to get a degree. And I decided that I was going to get an undergraduate degree in electronics and telecommunication, as far away from medicine as possible. But it turned out that I enjoyed optical communication and satellite communication. I really thought that that's where I was going to make my next miraculous move, and I'm going to be a star in this field. The year that I graduated, optical communication, the entire industry had a massive meltdown. There was no hiring. And once again, I was left with, what am I going to do? And as I was talking to people, I realized that I didn't know much. I knew a little bit of a lot of things, but I really wanted to learn more. The next step was I have to go get a master's. And there was this new field coming up called microfabrication. And I thought, that's cool, sounds interesting. And let me get into microfabrication. So I decided to get my master's in electrical engineering, focusing on microfabrication. And my work was focused on implantable devices, which is still a growing field. Implantable devices are basically taking real small devices, putting it on or inside the body to help with either monitoring or diagnosis, long-term or short-term, and aid in making the life better for people. And of course, the most common one that everybody might be familiar with is a pacemaker. We're all familiar with the pacemaker. So this is sort of what drove me into my master's. And this was a very interesting field. And I was kind of making my way into what we now know as biomedical engineering. And then I was intrigued enough to get into a PhD in electrical engineering, where I had the opportunity to learn something known as microfluidics, which is basically looking at really tiny channels of the order of the dimension of your hair, and how cancer cells might move in little channels that might be that small, and why they do it, really why they do it. And this is important because that is how cancer cells migrate, and they cause secondary tumors, and they spread all over the body, and it's really difficult to control. So this is what I got into in my PhD, and this was sort of my pivot towards biomedical, starting from telecommunication. This little video that you're seeing here is actually from my PhD work. It's showing cancer cells responding to a nutrient condition on the other side. So what we're modeling is on the left side is where the tumor started. On the right side is where the tumor is migrating. And these are cancer cells that are moving across. Of course, this video has been speeded up. They don't move that fast, but just in the for this illustration, I have speeded up the video. So what does this mean? Has any one of you considered biomedical engineering? I know some of you said maybe you know, or maybe your parents know what you're doing. So I wanted to take a quick poll and see if you have an idea about whether or not you've considered biomedical engineering as one of your top fields. Yes, no, maybe. All right, that's great, because I hadn't. I didn't realize I was making my way into biomedical engineering through my research. We've got about 50% saying no, 38, 44, 33, and about 22% saying maybe. So hopefully what we discuss here today will help you with this decision. I am going to end this poll. So the way I went into this field was that
if I sell it,
my current research, right? So I kind of made my way into biomedical engineering, and this is what I'm currently doing. I'm focused on wound healing and cancer migration and metastasis. This video that you see on the right is nanofibers, the black and white images of nanofibers and the color images of cancer cells on those nanofibers. And the reason I'm focusing on these two research areas is mainly because there is a lot of overlap in how wound healing occurs and how cancer cells migrate inside the body. Turns out that they're very similar. And this makes it interesting to understand why one is necessary. You want certain things to happen for wound healing, but the same things can potentially lead to cancer. So how do you prevent that? And that's sort of the intersection of research work that I am doing. And this was my introduction, or my way into biomedical engineering. So for wound healing, I am interested in looking at developing these nanofibers with these patterns. It turns out that patterns like these, without adding anything else, will actually improve the growth of skin cells. So for any surface wounds, this would be applicable. We were really happy to be chosen as a finalist for the Create the Future Design Contest for this particular idea earlier this year. And what you see here on the top left is what you would see if you were just looking at this patch, the patch that I'm holding here in my hand. The left image is what's known as a scanning electron microscope image. It's looking really in depth, and you're looking at the nanofibers in detail. This green and blue image on the top right is the skin cells. The green is actually what is known as the actin filaments, sort of the cytoskeleton or the bones of the cell that gives the cell its shape and structure. And the blue happens to be the nucleus. And you can see that the cells are actually growing in these pockets that we've created. So we compared this with a commercial product, and turns out that our patterns here actually have about 250% better yield than a commercial product. So we're very excited about this. I have 3 undergraduate students working on this research. The same patterns, but with different or similar materials with different patterns, can be used to assess cancer migration. So if you look at these 3 pictures on the top row, the first one is sort of like not aligned, it's mesh. It's just a really random alignment of the nanofibers. The second image is nice patterns. You can see there are these nice lines here. And the third one has like these little pockets where the cells can hopefully align. The lower row here is just the magnified images of the same nanofibers. And the way we use this is that depending on the type of cancer, turns out that different cancers prefer these different materials. So again, my undergraduate students work on this, and they found out that a highly malignant cancer in the middle panel here, that's how that would behave. An aggressive cancer would behave as on the right, whereas an undifferentiated cancer, or a cancer that could potentially become malignant, would behave as on the left panel. And I have about 4 undergraduate students working on this, starting from their first year. And they're providing all the data, and they've managed to publish this in a journal paper. So this is what my lab does, and this is really my take on biomedical engineering. So what really is biomedical engineering, right? We still haven't answered that question. What is biomedical engineering? This is what I do. But what is biomedical engineering? And a quick poll here, and this is the last one, I promise. So what do you think is biomedical engineering? Is it a combination of biology and medicine? Is it engineering, biology, and medicine, applying engineering in biology and medicine, or multidisciplinary and too hard to explain? What do you think is biomedical engineering? So we've got sort of a competition here between applying engineering and multidisciplinary and too hard to explain. The conventional explanation or description for biomedical engineering is the application of engineering concepts to biology and medicine, or to address problems in biology and medicine. And yes, it's definitely multidisciplinary. I'm going to end the poll here. We've got about 90% saying applying engineering. So it is multidisciplinary for sure. So I want to sort of address this in reverse. I'm going to talk about the possible careers in biomedical engineering and how different areas within biomedical engineering can lead you to this. Typically, biomedical engineers can focus on tissue engineering, healthcare and medicine, biomaterials, biomechanics, medical devices, or data science, which is sort of a new emerging field. If you're interested in tissue engineering, you're probably interested in biology, anatomy, physiology, and possible applications are in tissue regeneration, grafts, vessels, so on and so forth. You can get a medical degree, go into nursing, or be an EMT following a degree in biomedical engineering as well. Your focus would still be biology, anatomy, physiology, also additionally basic sciences such as chemistry and physics. Biomaterials is unique in that it already combines material sciences with biology. Examples would be biomimetic materials, or materials that sort of behave like conventional materials already available in the body. So you would either take materials available in the body or in nature and apply it. And development of biocompatible and biodegradable materials. The human body is an amazing system. Anything that you put in the human body, if it doesn't like it, it's very good at reacting and responding to it. So if you want to make an implantable device, if you want to make a device, even something that goes on the human body, you need to make it biocompatible. So biomaterials is a huge research area where you could potentially focus on biocompatibility and biodegradable materials. Biomechanics actually combines mechanical engineering with biology. You would focus still on biology, anatomy, and physiology, but on mechanical engineering concepts such as modeling for fluid dynamics and fluid mechanics, or the body mechanics. Human performance institutes, these are a huge avenue of research for those of you focused on biomechanics. You can also look at how tissues work. One possible interesting area is you have a lot of these skin creams that are introduced almost every day. So you could potentially put them on mock skins, test them, stretch them, and see, do they really make reverse aging? Do they really make the skin tight? So these kind of testings would fall under biomechanics. Medical devices, this is probably the most common one when you think biomedical engineering. Oftentimes what you think about are implantable devices, pacemakers, any of the medical equipment that you see in the hospital, this is what you would think about. This focuses on electrical engineering. And typical jobs as a starting job, when you get your undergraduate in biomedical engineering, you could potentially be in research and development, quality assurance and quality testing, maintenance, testing the devices, and sometimes even developing them. Data science is a more recent emerging topic, which is a special focus on mathematics, statistics, and computer programming. So for those of you who are interested in computers and programming, but still want to find a way to apply that in medicine, you could focus on data science. Most recently, you might have read in the news that they used artificial intelligence to determine the presence of cancer from image scans. And that is basically an output from data scientists in biomedical engineering. Of course, this just shows that biomedical engineering is highly multidisciplinary, but within these fields, also you can combine them. You can have fields combining, so you could take tissue engineering and biomaterials, for example, and develop stents and wound care products or surgical adhesives. So this image here is of a stent. This is a typical stent currently used. And this product here is an endoform product. It's commercially available for wound healing. Now, so you could combine tissue engineering and biomaterials to develop products like this. You can also combine biomechanics, biomaterials, and medical devices to develop implantable devices. So this image here at the bottom is of an implantable cardiac monitoring device. It's called CardioMEMS. It is FDA approved and it has been used in patients. And this image on the right is of a implantable retinal system called as the Argus. And so this particular system has an implantable electrode that's placed in the back of the retina. And the person wears these glasses. The camera on the glasses will capture the image, transmit it to the processing box that the person wears, processes the signal, sends it back to a wireless transponder on the glasses, transmits the data to the retinal implant that's placed at the back of the eye, which in turn will stimulate the optical cells that have stopped working. So it provides sight, and hence it's called second sight. And it gives the sensation of objects. So now they're able to gauge where they're going and get a sense for objects around them. So things like that could potentially be designed. And you could be the engineer designing either the wireless system, the retinal implant, materials to use for these glasses, the location for the implants, the lifetime of the battery. All of these would still fall under the purview of a biomedical engineer. All of that is great, but to get there, you have to get your degree first. So what do you learn in biomedical engineering? So if you get an undergraduate degree in biomedical engineering, is it easy? Is it difficult? Is it fun? What do you learn? So I want to take a few minutes to sort of quickly walk you through a typical roadmap for a biomedical engineer. In the first year, you learn a lot of basic engineering. Your focus will be math, physics, chemistry, biology. And typically this is where a lot of the students get a little frustrated because they're not seeing their biomedical engineering field yet. They're still doing advanced lessons of what they did in high school, and it tends to get a little frustrating. But if you stick in there long enough, another semester or so, when you get into your second year, you start getting a feel for the field. You're introduced to concepts within the field of biomedical engineering. You'll take classes in cell biology, anatomy, physiology. You'll probably take introductory courses to biomaterials, mechanics, maybe signals and systems. Each university does it differently, but typically this is the trend you would take. Of course, every year you have the opportunity to apply for internships and co-ops as well. And you can do this starting from your first year. And technical electives are introduced in the third year. What this means is you will take advanced courses in the area that you're interested in. So for example, in the previous slide, I mentioned about taking biomechanics or biomaterials. So you would take advanced biomechanics or advanced biomaterials. Or maybe you'll take classes in mechanical engineering or in electrical engineering to increase your understanding within this field. And again, you are highly encouraged to do internships and co-ops. And finally, in your last year, just as you're about to think, oh my God, is this ever going to end? You get to your fourth year, you'll have your senior design. You will take a few technical electives, but you'll do a team project. Typically, it is a research project either from the industry or from the campus, the university, or a group of faculty, and you get to apply all the skills you've learned in your previous 3 years into this project. So this is really what is sort of showcases all of the skill sets you've learned so far. And for those of you who are interested in grad school, this is when you'd also be applying to grad school. You'll be getting your job applications ready, trying to get your interview done. And of course, you will then go into, in the future, you'll either go into industry or academia. What is interesting, though, in biomedical engineering is that throughout all of this, in every year of this, you can actually carry out research. Even as an undergraduate student, you can have a lot of exposure to research in engineering. And so here are some typical examples of undergraduate students carrying out research. Here's a student looking at cancer cells under a microscope, working on an optical system, looking at a polymer molecule here, or building hydrogels or polymer complexes. I have a quick video here of some typical tasks that you could do even in your first year. So you can do cell culture, where you'll be working with cells that have been immortalized, so you can use them in a lab. And you do very simple tasks like adding media to the cells and saving them, or growing these cells and testing them under different environments. You could also work with polymers. You could potentially be electrospinning them. That's what's being done here. This is in my lab. So you could electrospin the polymers, and you will have scaffolds out of this. And these are my 2 undergrad students who work on this system. And once they have the scaffolds, they're going to take it into tissue culture. And of course, you'll take a lot of notes. You will learn, and you're trained for all of this. It's not like we're going to open the lab doors and say, hey, go do this. You'll get a lot of training. Senior students will train you, faculty will train you. You may even work with teams of graduate students to learn about all of this. What's nice, though, is that you have a lot of opportunities. You can do other things as well. I've got my undergrad students here working with elementary school students, 2nd grade students who did dissection of a sheep's eyeball, and my students volunteered to help the elementary school students with that. You can present your work. Of course, this is my student goofing off with this presentation here. You can represent your campus at events within and outside the campus, go to award ceremonies, win awards and accolades for all the work that you've done. So all of these are possible activities that you can have. Opportunities are, of course, endless. And this is true in any engineering field. I'm just talking about biomedical engineering here. What is necessary is, of course, that you take the first step towards it. And with that, I would like to conclude my little spiel on biomedical engineering. And if there are any questions, I'll be more than happy to answer them.
Awesome. Great. Thank you very much, Dr. Rao. That was very insightful. Greatly appreciate it. So the way we have structured our talks is we want our audience to be more engaged with our speakers. So please unmute yourself, ask questions, or you can ask questions in the chat box. You're welcome to ask any relevant question, and we would love to make it very interactive. And I hope Dr. Rao will appreciate any question related to today's topic.
Absolutely. I'm more than happy to answer any questions.
So go
one
ahead.
Thing yeah, sorry, go ahead.
No, go ahead.
The one thing that I did not touch upon is that undergraduate students searching for jobs through on-campus opportunities typically find it very hard to get a job in biomedical engineering.
That was my question, Dr. Rao. I was
yes.
about
I don't usually bring that up because, it comes with that idea that biomedical engineers don't find jobs on campus. That's not true. We actually have contacts with the professional advisory board with people from Stryker, Medtronic, St. Jude Medical, 3M, Thomas Scientific, and they all tell us the same thing, is that we hire people from our career site. We don't go to career week. We don't go to career fairs. So biomedical engineering companies, unfortunately, do not go on campus, which means that along with all the hard work that you do, you need to put in additional hard work to find your job. So yes, it is challenging for biomedical engineers. It is changing a little bit in the sense that there are companies now that will advertise for biomedical engineers and do it online as well. And will do it during the career week. But for the most part, you still need to look for your job on your own. Not quite sure why that is, but that seems to be the trend. I do see a question on the chat. If you don't mind, I'm going to read that out. Do you get trained for data science? Could you give me an example of what you do in data science? Excellent question. It is a hot topic. It is a relatively new topic. And one of the applications for data science that my graduate student is currently involved in includes taking images of cancer cells and using the data. So you create this massive database. You take thousands and thousands of pictures of cancer cells, and you use computer vision to identify the cells and isolate cancer cells from the non-cancerous ones. This is extremely challenging because if you could look at a cell and say this is cancer, this is non-cancer, you know, why hasn't it been done already? Because there is very little difference. There are certain techniques you can apply. So there are certain molecular markers that you could potentially apply to the cells and then take images and compare the images. And why is that important? Because not everybody can get an army of undergraduate students to do their work. And you certainly don't want your doctor to take scans of a cancer, send it to students in a university and wait for weeks for the students to figure out whether that's cancer or not. So if you could get computer vision, if you could get data science to help you to quickly identify the cancer versus non-cancer based on existing algorithms that you've developed, then you would make things much, much faster. So if you're interested in data science, I highly recommend that you do a quick Google search for looking at a cancer scan, a mammogram that a computer identified as cancer as opposed to a person. So they used a computer to look at mammograms and very quickly detect cancer. So that would be another example for application of data science, because you're working with huge amounts of data. It's not just one image or 10 images, it's thousands, if not millions of images that you're actually going to compare to get an idea about whether or not something is cancer or not. So that's one aspect of data science that I can think of right off the top of my head. If there's anybody else in the audience who has an example, I'll be happy to learn from that as well. Does that answer your question?
I hope it does. Yep.
Yes. All right. Thank you.
Any other question for Dr. Rao? It's a great opportunity to ask whatever question you have for her.
I did forget to put my email address, but you can find me on the Michigan Tech website. If you think of a question later, feel free to email me. I'll be more than happy to respond.
So one question, Dr. Rao, for
Sure.
the professions or the industries, those who do the undergrad and don't go into the research areas related to biomedical, what are the different professions or industries that usually your undergrads go?
So we have a huge swath of students who go into the industry. About 84% of our students actually go into the industry. And what is interesting is that in biomedical engineering in particular, because you have such a wide exposure to all these fields, you can make a case for why you should get this job that was earmarked for a mechanical engineer, or this job that was earmarked for an electrical engineer. As long as you have a few technical electives in that area, even without research, you can very easily find a job. Again, as long as you go online and do your search. And so typical jobs for engineers who have not taken any research or have even not had any internship or co-op experiences still revolves around getting into, they typically begin as a test engineer or in quality assurance and quality testing in a medical device company. A lot of the students take a more scenic route like I did. They'll go to alternative industries and come back. I have one student who actually went into aerospace engineering, had a focus on electrical engineering in the aerospace industry, and now works for a medical device company. So experience really is what counts for your first job, in the sense that if you are making your way towards biomedical engineering, if you can show consistent growth in a specific area, whether it's mechanical engineering or electrical engineering or material science or even biology, then you could go in that direction. If your focus is tissue engineering, you could potentially get into any of the companies making wound healing products. They're always looking for people with a background in biology. Material sciences, again, a lot of the companies are looking, any medical device company will be happy to take a material science focus person to work on their implantable devices, internal as well as external applications, as well as research and startup companies, and the same with electrical engineers. We've had engineers go into, I have one student whose job really is to test medical beds, how easy and how difficult it is to break a medical bed. Because as you're transporting the patient, you want it to be able to withstand certain forces. You know, when you put it on, if you put it into an ambulance and you pull it out, you stick it on a stretcher, would it break? Which for me is a fun job. You know, you're getting paid to break stuff. And that's still something a biomedical engineer could do. So it's really, really broad and wide. And I hope that answered your question.
It does, thank you. We got another question on the chat box.
Which are the world leading groups in the field of biomedical engineering? Which universities, leading experts' names? Thanks. So if you look at, again, for biomedical engineering, it is such a huge area. So if you're looking at electrical engineering, if you're looking at implantable devices, locally, I can say University of Michigan, there is the wireless implantable group called WIMS. They are pretty well known for their implantable devices. If you're looking at cancer biology specifically, you can look at Cynthia Reinhardt King and the King group out of Cornell. They've done a lot of work on cancer biology. There is Dr. Bissell, whose focus is really on mechanobiology and cancer, and is considered the leading authority on cancer biology. If you're looking at material science, this is really spread out. It's really wide and far apart. You've got teams in, say, for example, the Polytechnic University in Milan, Italy, is developing a system to 3D print nitinol stents. There is a group in Australia that is developing a 3D printed tissue system. There is a company here in the US that has just started 3D printing, screen printing tissues. University of Cambridge in UK, definitely, they have a lot of good work going on. I've had the good fortune to listen to a couple of presentations from there, including one on nanotechnology, which was very interesting and was very well received in the academic world. Their publication was very highly ranked. I think it made it to the top paper 2 years ago. So again, it depends on what your focus area is. So I would highly recommend looking at research area first and then going backwards to the university. There are some small universities that are doing some really good work as well. So I would say, don't just go by the big names. Sometimes the small universities can also have amazing faculty doing some really cool work. What advice would you give a high schooler who's interested in biomedical engineering? What are the ideal colleges for biomedical engineering? Advice to a high school student. What I would say is, keep asking questions. And when you decide that, of course you're going to go into college. If you decide it's biomedical engineering, don't wait. Reach out to faculty. There are a lot of programs that will take high school students in the summer. So I highly encourage high school students to apply to those programs or participate in those programs. Right now, I understand with the COVID situation, you may not get a lot of hands-on experience, but a lot of the universities have online lab kits. So if you sign up, they'll send you a little kit that you can build at home, and you can interact with other high school students who may have similar interest as you. And I highly recommend that you take a look at these websites. Even if you haven't had the opportunity to participate in them, just get a feel for what are the kind of things that they do. Ideal college for biomedical engineering, and I'm biased here in the sense that I really think that biomedical engineers should get their hands into research early on, at least one semester of research. So any university that allows students to participate actively in research and give students the opportunity to publish or participate in conferences, I think those are really what will help you in your future career. So you kind of have to be a little selfish there and say, it's not about how big the school is or how well the faculty is known. It's about, will you get the opportunity to showcase your skill set really well on your resume when you graduate? Will you have opportunities to interact with the campus, get involved in extracurricular activities? Will you have research opportunities? Will they allow you to present on your own? These are really the research groups or universities that you want to focus on, so that when you go to your interview, you have something that you can talk about passionately, because that's really what gets you hired, is your enthusiasm when you go to your interview. So that's what I would recommend for high school and for colleges. I hope that answered your question there. There's one more question. What is your general advice to young people you want to enter this field? You have to continue to be curious. You have to be open to ideas. Keep reading articles, and it could just be a new snippet. I'm not saying you have to bury your head in a 100-page thesis every day. Just read biomedical news. There are some really good newsletters out there focused on general audience. So just get a feel for looking into those. And I think it's very important to figure out, by the time you get to your second year, what is your area of focus going to be? What is your strength? Is it electrical engineering, mechanical engineering? Maybe you don't like biomedical engineering at all and you want to switch, which I think is okay. You'd rather do that now rather than after getting 4 years of degree and you don't like it. A lot of the biomedical engineers go into medical school. This is something I did not talk about. And medical schools like to get engineers in because they're already trained in the math background. So believe it or not, in medical school, you actually do a lot of math because you model the human body as a system. So you learn all of these concepts that you learn in engineering, you're actually going to apply that. So going into medical school with an engineering degree, doesn't matter what engineering degree it is, you'll actually have a little bit of a leg up on the other people who come without an engineering background, without a math background, because these things are going to seem a little easy for you. So, keep focusing on your strengths and what really intrigues you. Don't go all over the place like I did, but hopefully you'll figure it out soon. There's another question here. Is there a big difference when going into biomedical engineering from a biomedical engineering undergraduate degree compared to getting a mechanical undergraduate degree? This is a very good question. I do get this a lot, and the short answer is no. And the long answer is it depends, because it depends on what you want to focus on when you go into biomedical engineering. So because you have an undergraduate degree in mechanical engineering, for example, then when you apply for your master's or your PhD, the typical trend is that the graduate program committee that looks at your application will put you in the mechanical engineering group, unless you make a special case on why you should be working in a different group. So there is a tendency to stick you back into the field that you came in with, which is mechanical engineering. Let's say you want to switch to electrical engineering from there, then in your personal statement or in your statement of purpose, you'll have to make a case on why the skill sets that you've learned could be applied in electrical engineering, or why you want your research focus in your master's or your PhD level to be electrical engineering, for example. The main difference is that coming from the mechanical engineering background, you will sort of be the go-to person in your research group or in your study group, because you'll know these concepts much better than the others in that group. So it's definitely a plus if you already have a degree. And again, you could get some of the prerequisite classes waived off because you're already from an engineering background, which is always a plus. You can choose to build on mechanical engineering or divert from there and increase your knowledge from there. So nothing bad, really. All right. Thank you.
Very good. Dr. Rao, you mentioned WIMS. How do you spell that for implantables?
WIMS.
Okay, great. And for the biomedical engineering degree, especially undergrad, do you think engineering is more heavy or the bio side more heavy?
Engineering is more heavy. There is definitely a little bit of a misunderstanding that biomedical engineering will do a lot of biology. It's actually a lot of engineering, which is why you'll also see a lot of the students sort of drop out after their first year because they were put into all these heavy math and engineering classes that they did not expect. One of the things that I can tell for the high school kids here, if you're taking those advanced placement classes, especially in math, try not to waive your math in your first year. Advanced placement classes are great, you'll do really well, but take some math classes even in your undergraduate degree, because that will sort of train you to the kind of expectation at the college level. And that, I think, is really what is confusing for students. Is they come in, it's biomedical engineering, you want to go learn more about biology, and you're thrown into all these engineering classes. You do learn biology, so you'll learn tissue engineering, you will learn cell and molecular biology, you will take classes in physiology and anatomy, including labs. So you will have exposure to all of those, because you need to know if you're using something for the body or with the body, you better know how the body is going to respond. So you will get those basics as well, but you're not going to go into advanced cancer biology, for example, without actually choosing that as a technical elective. So I would still say it's engineering heavy.
Okay, very good. Any other question from the audience?
I hope I didn't scare anybody with my spiel on engineering there.
So do you think somebody who is planning to also have kind of plan A and plan B to use biomedical engineering as the stepping stone towards the medical fields later, will that be, is that a good idea, or will it be too overwhelming to have biomedical while you're also thinking of getting some good grades and getting into healthcare, I mean the medicine side?
So very good question. Actually, pretty much all biomedical engineering schools will have a pre-health or a pre-med track. So what you would do is in your first year, you would basically go speak with the advisor and let them know that you're interested in going into medical school. So you will be sort of guided into some of the prereq classes that the medical schools look for. So you're not going to be deviated a lot. You'll probably end up taking about 3 additional classes than your other teammates who are not going into medical school. But it'll definitely help you because, again, the courses that you take will train you for the MCATs that you're taking, especially the chemistry, the biochemistry, and the physics portions that you'll be questioned on in your MCATs. You'll be very well trained for it. I've personally had a lot of students go into medical school, and in hindsight, when I talk to them now, they always complained when they were in the program that it's too hard, that engineering was not what they wanted to do. But now in hindsight, when I talk to them, they always say, it's because I did biomedical engineering that my first 3 years in medical school was easy for me. I didn't have to work as hard as the others. So I think it would actually reinforce medical school.
That's interesting to know. Very good. Any other question from the audience? You can post your question in the chat box, or you can unmute yourself and ask. And I'm going to post a link to a feedback form as part of the continuous improvement, improving our quality of this community service to help our community become more aware, more knowledgeable about the different fields and different areas, different majors. We want to hear directly from the audience to see what other areas they're interested in so that we can bring the respective subject matter experts from those fields. So please do provide us your feedback through this form. It will help us to bring to you some really quality programs that you actually care about. So if there's no other question, I would say, Dr. Rao, thank you very, very much. I really enjoyed it, and I hope the audience benefited a lot from your answers. They were very detailed, a lot of good pointers, a lot of good advices for the high school and college youth, and if the parents are here. And it's actually good for parents to listen to the professor because that gives them a little kind of background and better understanding when they are conversing with their children, especially the major, change of majors and why I should do that and why not, and you can have a little better informed discussion with your kids. So thank you very much, Dr. Rao. Really greatly appreciate your time. And I would also like to remind the audience that STEMatters, our mission is to inspire students to excel in the areas of science, technology, engineering, and environment matters by nurturing their critical and analytical thinking skills. We coach and mentor middle and high schoolers and prepare them for the national and international STEM competitions. I think somebody is not muted. Give me 1 second. So we are going to have our next cohort starting in January, and the information session is on Sunday, December 13th. And if anybody is interested in joining that information session, please you feel free to join us. It is a free session for information, and I have posted the link. So please sign up if you're planning to enroll your students in our January cohort. So Dr. Rao, any departing comments, any last comments from you?
No, I just want to thank you for having me here. I think, again, I want to say what you guys are doing here is amazing. I think STEMatters and Young Professionals is, it's a great team up. And again, I wish I had this opportunity before. And I know a lot of my friends who are planning for their kids would love to be a part of this. I'll be sharing this information with them as well. Thank you for having me. And I hope everybody learned a little bit more about what I'm doing and what biomedical engineering is all about. And please feel free to reach out to me. I've put my email address on the chat, or you can also find me from the university website at Michigan Tech. So thank you, and I hope everybody has a wonderful weekend.
Very good. Thank you all.
Thank you, Dr. Rao.
Thank you.
Take care.
Have a great evening, great day for all of you. Take care. Goodbye.
Bye-bye.